Hey guys, Zach here again. I'm super excited to announce, to introduce Zubin Damania, Z-Dog, who's a good friend and actually one of the early folks that was one of the inspirations behind why we started Hint. Early on, Z-Dog was running Turntable Health and our sort of interactions with him, one of the things that actually led us to starting Hint. So I'm really excited to announce, to introduce Zubin, and he's going to be interviewing this interview of him with Marty Makary, so you heard from earlier on. So thanks so much, and looking forward to it.
Hey everybody, we're at the Hint 2D Summit. Doing a interview with one of my favorite people, a good friend. He's been on the show a million times. He really needs no introduction. It's Dr. Marty Makary. He's like a Johns Hopkins bigwig surgeon. Like, I don't know. What else would you say about yourself, Marty?
I'm a simple country doctor blessed with many friends like yourself.
It's funny. That's actually the topic of what we're talking about today, right? Which is like bringing medicine back to the roots, the moral roots that we went into it to do it for, right? And this whole summit thing that they're doing at Hint Health. Hint is really kind of an enabler of primary care practices, kind of going back to this idea of, I can directly contract with a patient for a price that's clear for services that are well-defined to take care of them and keep them out of trouble. And you wrote a whole book called The Price We Pay about how big health systems and small health systems are screwing patients through lack of price transparency. I mean, what do you think about all this?
Well, there's so much waste in healthcare that the only way we're going to ever get a handle on this system as physicians is if we bypass this middle industry. I mean, we cannot manage it, right? We cannot tame it. We cannot outrun this lion, right? This is a giant middle industry. And the most exciting thing happening right now is folks saying, hey, you know what? We're going to offer a better value proposition by you coming directly to us. So that's the thing. And
you nailed it. In this middle industry is like, whether it's insurance people, whether it's like a big corporation, whether it's a private equity firm, like all these things get in the way of the simple physician-patient relationship. And so,
doctor, we need a pre-approval before you can say that. You're not pre-authorized to say that. You've got to call and then do a peer-to-peer.
I need to get pre-auth just for the crazy statements I make on my show. Like I'd have to call up United and be like, please hold. And then you're sitting there and you're listening to this hold music that's like Chuck Mangione. It's like, and you're like, I want to die.
Now, I think that's unfair because the peer-to-peer dialogues I have to have with my pre-authorizing managed care organizations have pretty good music on their hold lines. Actually, I enjoy it.
Oh, yeah? So it's like a little more upbeat, a little up-tempo number while they're screwing you?
By the third or fourth song, it usually picks up. The first few songs are slow.
I get through about 7 albums before I actually talk to a person. And then they're like, so why do you need that CT scan? Because he has a visible growth coming out of his skull. So I think probably that's a good indication for this scan. Well, did you try a standard x-ray first? Oh, really? So you're a doctor now. I mean, that's what it feels like.
Managed care came with the promise in the 90s of justifying its cost by reducing overall utilization. And that was really the basis for the entire social experiment of bringing in a manager of care or managed care. After 10 years, the evidence was in, and guess what? Any savings they delivered was far outpaced by the cost of them managing care. In other words, the entire experiment was a massive failure, but they didn't get rid of it, right? I mean, they set up this giant stakeholder interest, and they didn't just say, oh, we conclude this isn't worthwhile, we're going to scrap it. A lot of people got rich. I mean, thousands of people became millionaires off this system.
It's the bureaucratic industrial complex that sprung up to manage the care that costs so much of the money. But the truth is, but doctors, so let's play devil's advocate. And I think this is important because you care about quality. You also care about people doing the wrong thing. You care about care variation, these kind of things, unexplained care variation. How does that fit in all this? Because if we don't have the managers to manage the care and you just let doctors take care of patients, what's to stop them from doing it very poorly?
First of all, I'm flattered that you're describing me as a caring person. Thank you.
You're a surgeon, so they are oxymoronic statements.
Every now and then a nurse will say, excuse me, Dr. Makary, sorry to bother you, but can I cut this Lasix dose down from 20 to 10 because they've urinated 4 liters of urine in the last hour? And I'll say, yeah, sure. And they'll go, okay, thank you. Can I just say you are so nice? And I'll say, well, based on what? All I did was say, okay. I mean, it's a very low bar. I don't know what some of my colleagues are saying in response to that question.
I think you kind of nailed it. Like I've had the same thing with nurses. It's like, Dr. Damania, you are the nicest. And then I take a personality test and my disagreeable score is off the charts. Like it's unmeasurable. And I'm like, wow, I'm the nicest doctor that you've worked with. Like this is a bad sign, right? But so how do we then assure good quality if there isn't a quality industrial complex measuring everything and forcing it?
Well, yeah, I love it. Quality industrial complex. By the way, the military industrial complex is getting a little stale and they're not making as much money. So now they're taking courses from the medical industrial complex to learn how to make bigger margins.
Exactly. It's a little known fact. They're watching MASH reruns. Yeah.
They're hiring hospital administrators to be consultants in the military.
Is this really true?
No, I just
I believe it. I was like, yeah, no, that makes sense. Because if you want to really, it's very hard to screw up the military more than it is and make it more bureaucratic. Except go to medicine and you can learn how to do it.
I think there's like migration patterns with consultants, kind of like birds, And the biggest migration pattern by far are people in aviation coming into hospitals saying, oh, you got to do this differently and that differently. We had some come to the operating room and they were like, oh, we got some, Lean Sigma triple black belts and they're going to show you what to do. And here they're going to, change your systems and it's all abstract. And they sit down and explain all this stuff. And I'm like, dude, they don't even know what glove size to pull every time I walk into the operating room. And I've been there 17 years. But no, back to DPC. The reason I love direct primary care is that there is a benefit from offering relationship-based medicine and spending more time with patients and getting into the real drivers, the underlying root causes of illness. There is definitely a benefit there. Historically, stakeholders have not seen the direct ROI, so they've been skeptical of it, but it's definitely there, right? We all know that. You saw that in your experience. I've heard you speak on that experience with Turntable. But the reason that I think things are right for DPC now is that they manage the referrals as well. And so instead of referring somebody into a standard queue, they are referring their patients to doctors that know what they're doing, give them feedback, stay in the close loop of communication. Remember, communication breakdowns are a major driver of quality problems. And they pick the doctors that have good surgical quality, specialist quality, you name the area, and will have good billing quality. Because if you send a patient to somebody who's, balance bills them $2,000, dollars for an eye exam, guess what? There's going to be some accountability, and primary care is in a great position to be the gatekeeper of all things quality. And they've already done that. A lot of doctors have done that in smaller communities. So now you're seeing this sort of this idea. I mean, you look at what Hint's doing, you look at what a lot of these DPC groups are doing. They're not just referring randomly, right? They're creating alliances. I've seen it with IORA, I've seen it with ChenMed, I've seen it with Firefly, some of these other groups. you see where they're actually going through a process to say, hey, we want to partner with you as an endocrinologist, and we'd like to work with you. We'd like to maybe channel those patients with diabetes who really want to get serious, and they want to spend a lot of time, and they want to get really good. They want to learn about food as medicine. They want to learn about cooking. They want to learn about what to eat, what not to eat. They want to learn about how to get lower doses of insulin. To me, that's the most exciting thing right now. What's happening? It's called relationship-based medicine. It lives and is born with DPC. And when you hear about, I'd met this woman in San Antonio who's an endocrinologist, and she's doing this now as an endocrinologist working with DPC. And she's saying, for the patients with diabetes where it's hard to control, if they are serious about addressing their diabetes, I'd love to work with them. Okay. Now, remember, it's like smoking. If you don't want to quit smoking, no, let's not waste our time with those patients, right? If they don't want to quit, they're never going to stop, right? We're just going to spin our wheels, and we need to keep making the case of the health benefits of stopping so they become motivated. But if they're not motivated, let's put the resources, focus them on people who want to get better. So these folks, let's say you got 30 patients with diabetes at a company, 20 of them really want to get serious. The others, hopefully soon they'll come around. And then they go in these intense relationship-based programs where they learn about food and cooking and insulin management, and they have hand-holding and accountability and time and build a relationship. Guess what? You see an ROI, and these groups are reporting back an ROI like you would not believe in 6 months, in a year, and it's in partnership with DPC. That's what I love about DPC.
For a second, I was worried you were going to dodge my question about how quality is improved without managers, without oversight, without those kind of things. And you just answered it in the most beautiful way, because that is what we learned at Turntable. You just get paid to do the right thing for patients. And you have to figure that out, or the patients are going to walk, the employers are going to walk, the businesses that are paying you to take care of their patients are going to walk. And the way you do that is you form a relationship with the patient, you hear what they're saying, and you nailed this, Marty, you form relationships with what we at Turntable called it our Good Guys Network, the alliances of specialists that aren't complete just ding-dongs. So they're the ones that are not cathing GERD or, scoping people unnecessarily or doing procedures to generate cash. They have high quality billing practices, which you mentioned. So the patients never get a surprise bill, all this other stuff. And so as a result, those happen to be also very high quality practitioners. So pretty soon you have better outcomes. You have better relationships that drive the better outcomes. You have better relationships among the caregivers, the providers themselves, which then emerge better outcomes. And not a single piece of it requires a tool bag at United sitting on the phone going, we don't think this CT scan is warranted. Not a single piece of it. And people at this conference, at this HINT conference, know this because they're doing this, right? And I think people who are watching on the replay on the ZDoggMD show should understand direct primary care is saying, just get paid a flat fee to do the right thing for your patients and watch what happens. And we've seen it happen. And you wrote a book and you incorporated these stories from ChenMed and Iora, and you mentioned newer ones like Firefly. I mean, this is a thing, dude.
First of all, I want to thank you, and I'm sure the sponsor of this HINT Healthcare, United Healthcare, would like to thank you as well. No, I'm just kidding.
I've done that before, Marty, where I've railed against a particular company, and it turns out they're a sponsor of the event, and then I'm just sitting there like.
Well, what I love about the Z-Man and the Z-Dog Industries and the 2 Gs in the dog is that there are very few people uninhibited to speak freely about what's wrong and broken with healthcare and what inhibits us as doctors from being doctors. Very few people feel that sort of liberty. And unfortunately, too many people are worried about what somebody's going to think. And I think we need more fresh voices like yourself. So anyway, I think it's awesome. Now, United is not the sponsor of this gathering. It's HINT Health. United is busy right now because got fined millions of dollars for crossing over payments from self-funded employers and their own fully insured patients. So they were doing some horse trading where they were kind of like to the hospitals, hey, we're going to overpay you from the self-funded plan, from the pot of money an employer set up for their employees, because we manage that account. And we're going to underpay you from our fully insured patients. And, it'll kind of wash out. Well, guess what? They got busted. So there's a big anti-fraud settlement that just came out around that. But there's so much of that stuff going on where it's like, why can't we just speak openly and honestly about it?
Exactly. And it's interesting. I was talking to Zach, the CEO of Hint, on a show that we did, and he was talking about who sponsors this event, this Hint Summit. And he says, the only sponsors we allow are people that are actually providing value for direct primary care physicians who are trying to do this, because you need infrastructure, you need support, you need technology to enable the relationship-based care that allows you then to let the technology go, right? And what you said about insurance companies is interesting. So who's making a profit right now during this pandemic? Is it frontline physicians that are in a fee-for-service model? No, because all their elective procedures went poof. People are afraid to go to the doctor. Hospitals are struggling, which is kind of also nice a little bit to see sometimes, because it'll shake them up out of complacency. But the insurers are reporting record profits. Why? Because they're charging the same premiums and providing less care.
How much money are they making off of COVID right now? I mean, they're not paying anything, right? I mean, where's all that money going? All those premium dollars right now.
I mean, whoever the CEO of United is it's in his gold-plated land speeder that he's, flying around, because he has a land speeder. He has the technology. Well, when you have that kind of money.
The thing is that if you and I had dinner with the CEO of United,
he'd be the nicest guy in the world.
I want to bet that we would walk away thinking, oh, he seems like a really nice guy. He's trying to do his best. I mean, I have this experience a lot, where it's like
all the time.
A stakeholder is so offensive, but then I meet the individual and I think, gosh, they're doing their best within a broken system, and they didn't design this system, right? None of us designed this terrible system. We inherited it, right? And some people are working for good and trying to make it better.
I find this every time I talk to stakeholders. I've only met a handful of these, so let's say it's in, AHIP, who I've spoken for. I've spoken for America's health insurance plans. And what I did during the talk, and it was thousands of people, like George W. Bush was one of the speakers when I was speaking. And I got all this crap from direct primary care people who were like,
I wasn't born. Was he a president or something?
He was the current president may have given him a little political Botox, because at the time... But the long story short is talking to insurers about what I call Health 3.0 and our direct primary care model. They were fired up. They're like, how do we do this within the paradigm of what we're doing with self-insured companies and things like that? So there are no bad guys. There's a bad system. Now, there may be a couple bad guys here and there, right? Like the Dr. Evil petting his cat. But even he's got a heart of gold somewhere deep in his bowels. There's a heart of gold, Marty.
No, we don't gnaw on our kitty.
When I was at the age of 14, a Zoroastrian named Vilma, ritualistically, I'll stop there because this is a family show.
And you are Zoroastrian, isn't that right?
I am. The first time I heard him say that, I'm like, wow, that's the first shout out my disappearing people have gotten in pop culture ever. Except for Freddie Mercury, who never mentioned he was Zoroastrian.
I miss a good Peter Attia impersonation of Dr. Evil. I think I'm going to try to hit him up for that pretty soon.
Hit him up. He'll do the whole thing. Scott, zip it, www.zipit.com. Sorry.
Hey, what are people
were we talking
thinking
about?
right now who are watching us? Are they thinking, gosh, I wish these guys would talk about something serious and real? Or are they thinking, I'm enjoying this?
You made a sort of a logical fallacy right off the bat, and you said, what are people thinking who are watching us? That assumes people are watching us, Marty, because I'm pretty sure right now everyone's just turned it off because we're too handsome, just too handsome.
Well, I did tell some of my people in Texas to tune in, so I know at least two people. But let me get to something really serious for a second. I want to change the subject. When word of a deadly pandemic came to the United States, the very first thought that people came up with in their brain was toilet paper. Why?
You know those 3 dots that mean therefore? It's like pandemic, coronavirus, 3 dots, go hoard TP. That was just it. It didn't happen in your head? Because I still am trying to dig out from a mound of toilet paper that I was able to abscond with. And here's the thing. I have a bidet. I don't even need toilet paper. Just water. That's all.
I don't. I mean, I had a lot of fears when I heard about the virus and what was happening in Wuhan, people dying, the hospitals being overwhelmed. Having to use the toilet without toilet paper was not the first thing that came to mind.
Well, then you're just not a red-blooded American, Marty. That's the problem with you immigrants. You just don't understand what's important.
Did you see this story? Speaking of coronavirus, Cleveland Clinic. By the way, how many people or organizations are we allowed to offend on a single show? Do you have a cap?
Well, so it's Hint Health that we're talking about. So I would say it's unlimited. I don't think there is a cap. I think you just go ahead and start offending them.
Well, Cleveland Clinic, it just came out here. This was in a MedPage story. Accepted $1 billion in CARES relief taxpayer bailout funding. I mean, they spend, I heard, $90 million a year on their marketing. I mean, they're on buses in New York City. I mean, they're advertising around the world. They got a bill. I mean, are they going to pay that money back?
They needed the relief, Marty, because all their elective cabbages and, various surgeries that weren't happening was just sucking money out of their system. I mean, you have to feel for them. I mean, yeah, sure, the average Joe is unemployed and gets $600 a week or something, but I'm sure the CEO or whoever it is at Cleveland Clinic needs that gold-plated land speeder to be tuned up Q month. So who's going to pay for that? The taxpayers.
Well, I understand there are certain hardships that they might be going through right now, but I do hope that when times are good, they're going to remember that the American people bailed out the institution.
100%. They'll
We're
remember.
Taking
They'll
the
remember.
Full rope here of when Zach said we can do whatever we want with this segment. I mean, we're doing exactly that right now.
Yeah. What's funny is this is exactly the spirit and heart of what the direct primary care movement is. It is almost like the old school militia of doctors standing up and saying, we're not going to take it anymore. We're not going to let these punks tell us what to do. I'm never sitting on a direct prior auth call again, ever. I'm going to have a relationship, not only a direct care relationship, but a direct financial relationship with my patients with no middlemen. And, and what Zach did back with Turntable, we were their first client, is they said, let us give you some software that helps you not be such a complete idiot about how to actually enroll patients for a membership model. So they can put their credit card in, it's all secure, and you can keep track of them. You can know where the memberships are. And that way you don't have to think about that. You just take care of the patients. And it was brilliant because it freed us to be docs.
That's your connection.
That's right.
Hint Health. Okay, interesting. And did you get into this with your time with Zach, which I know is going to be part of the conference?
Yeah, I did, and we went into kind of how it all started, but just the one-liner, because that may be released separately. We were opening Turntable. We couldn't figure out how to bill patients a membership fee because nobody does that. And we went to Salesforce and they said, here's some consultants that cost a ton of money and we'll build you a database that will do this. And I'm like, I'm a doctor. I have no idea what you're talking about. And Zach came up and he's from New Zealand and he's like, I've got a way to go ahead and, make some software that'll just go ahead and bill everybody. And I was like, I don't know what you just said. I couldn't understand a word you said. And I'm like, but I'm going to hire you to do this thing. And at the time now he admits he's like, it was complete vaporware. There was nothing, but I figured by telling you I was going to do it, it forced me to go and do it. And then he did it. And now they have, so many direct care practices. And so we were their first kind of test, and you could see them kind of iterating with us and being completely open and building it on the fly. And it turned out to be this great thing, even though we ended up having to close because we ended up aligning with an insurance company that went out of business and we lost all our patients, right? So that was a nice lesson, trying to be everything to everyone. They're now scaling the direct primary care movement. They're like a catalyst for this community and this movement. So it's been wonderful to see.
And then you get these employers who really get it, and they say, this DPC idea, I want to do it, and I want to do something different. And they take these bold steps to say, hey, we're going to contract with a direct primary care group. And then the stories just start coming out, and they come out, and you learn about these individual patients where they're getting the time and attention they need, and the doctor will meet them at the workplace, or they've got somebody who's interested in occupational health who will go to the site and figure out how to prevent workplace strain injuries, and work with physical therapists and nutritionists. And, and it's to me, it's sort of maybe going back before this giant healthcare industrial complex started, and practicing medicine back in time, but with the benefit of all the knowledge and technology and information that we have today. And so I think it's just refreshing. I mean, I think it's just so cool.
I couldn't agree more. And that's what it was like doing the practice of it, man. It was just liberating. And it's the stories, right? So people will be like, let's see what the ROI is on this. So how much money did you save in 6 months and a year? And we could show that. We could go, oh yeah, you saved 12% in the first year, but then it starts to regress to the mean, because you need to take another 5 years to show you prevented a case of diabetes or a heart attack or a stroke. But then you take the story, the return on stories, and you hear, oh, this patient was on 20 meds. They're now on 1. They were seeing 20 bogus specialists, all of whom were not talking to each other. They're now seeing 1 specialist and you. The care is coordinated. The patients got their life back. They're off. There's bags of meds piled up in our huddle room that we've taken people off. Like, that's the pride. Oh, we didn't get the guy to take his meds. We were able to make it so he didn't have to take his meds. Like, that's the pride of accomplishment, and it brings the joy back. And I tell you, our docs were working harder than they've ever worked, but they were full of purpose and joy because that's what they wanted to do. It's not about patrolling through the number of patients to make your quota or hit your RVUs or all that. And then you have a team, which also makes it much better. So having that team dynamic really changed everything for us.
When things are not going well in healthcare and centers or clinics or hospitals are not making money, I'm finding that increasingly the response of many of those leaders are, you doctors have to work harder, right? You've got to work, you got to go faster on the treadmill. You've got to work harder. And the reality is DPC has essentially disproven that mentality, right? They've basically said, it's not just you got to crank out as many RVUs in a 60-minute time frame as humanly possible, but it's actually delivering care differently. And I mean, let me ask you, I mean, you actually are like a real doctor who has seen patients in a primary care capacity. I'm speaking as a specialist here, but let me ask you, what was, one of the most moving things that you saw that proved the notion that we all believe, but not all of us have seen, where if you actually can focus on the underlying issues, you can save a ton of pain and a world of hurt and a lot of money on the side. I mean, I remember from your talk when I heard you speak a while back, the thing I remember the most, and you're going to think, you don't remember my songs and all. I do remember that stuff, but the thing I remember most is the visual image that I left with of bags of medications, because you were describing people coming off their meds and you'd have these bags like trash bags. You throw out the meds as you get them off the meds, and this image of bags of medication, it just stuck with me.
And that's what it is. And what you actually What you resonate with is the story, the human story of the care. And that's what resonated with me, what I would see. And, honestly, the doctors who were running that clinic were doing all the work. But then I would sit there in the huddle and listen to the stories and go, oh my God, you saved this person's life. And you don't even know it yet, but you can see it. And it's often a patient. This is the thing. It's often those patients, and the people in the audience at Hint right now understand this. It's those patients that were the chronic disease, or whether it's fibromyalgia or chronic fatigue, or one of these, what we call the difficult patients. When you see them frequently, you spend time, you listen to the root trauma that's driving all of this, you realize, oh, that's what it is. This is a whole person here. And we've been trying to put Band-Aids on all this stuff and giving them opiates and doing this, and let's give them Neurontin, and let's do, how about this? How about listen to what they're telling you? And out will come these beautiful human stories. And just the act of compassionately witnessing their suffering adds something to the care and opens a door that then you can do more. And I see it again and again and again and again and again. I think the people who are direct primary care practitioners, they don't just see it, it's a visceral experience for them, and they know it. And then when they have to pitch to an employer, well, why does this thing work? You go, let me just share some stories with you, right? And employers, there are these HR people, and bless their hearts, but they want to see, well, so do you have ROI data in terms of dollars per premium spent per PM per member per month of how much is saved? And it's like, no, but I have this and this and this, stories and stories and stories, and then talk to my patients and see what they tell you. And that's where the thing emerges. And you just know that this is going to, now you have to be careful because we're talking about outcomes. But the truth is, let's say direct primary care costs the same as the current system, but you have these stories. What are our current stories? I was robbed at gunpoint by a healthcare system that billed me for stuff they didn't tell me about. My doctor spent 10 minutes with me and looked like he wanted to die himself. He stared at the computer the whole time. Like, those are the stories we get in the current system, right? What are the stories in direct primary care? Oh my God, this transcendent thing. Well, hey, even if it breaks even, that's worth it, right?
Were those reviews from my Google page that you were reading, or was that anonymized?
It turns out I'm friends with the health grades people, and I just said, can you give me Marty's real data? I want to see what the people are saying. And there were things like, he meant to take out my pancreas, but he took out my spleen. And but he was nice about it, so I let him have that.
Well, one of those ratings groups, I don't think it's health grades, it's another one, lists me as an OBGYN doctor, which for those of you who don't know me, I'm not. I'm trained as a general surgeon. But what happened in the visit where somebody left with the impression that I was an OB doctor?
It makes you wonder about your bedside manner. I mean, it's vaguely unsettling. And the strange thing is, it was a guy who left the review. That's what makes it ever so more awkward.
But it's
funny
about a path. I'd like to change the subject. So
you'd like to derail it.
I'd like to derail it. So there's something I got to mention because it's so obvious to me. And in talking, you and I have been given this awesome sort of privilege by the medical community, by society, to meet so many folks, right? You get to go visit so many hospitals, talk to so many practicing doctors on the front lines, and it's inspiring, right, to hear these stories. And I personally think because we've been measuring quality the wrong way, we're just measuring with things that are easy to measure and cheap, right? Readmissions and post-operative infections are the cheapest possible ways you can analyze data, right? I mean, you could have, your first year analyst pull that in an hour, right? It's very inexpensive. So we've relegated measuring how we're doing as a profession to these really crude, blunt tools. And it turns out that what we're not measuring are these things you're talking about, right? The entire patient interface with the broader healthcare system guided by their primary care physician, the quality of the referrals, the communication, reliability, the safety, how much their doctors are up on the latest care, and how much time they spend getting at the root underlying issues, food, environmental exposures, sleep, things they're interested in, things that actually influence chronic conditions. So I think I have this theory that we've had major strides in primary care by leaps and bounds, driven by the relationship-based model, which you can only do in direct primary care or some other globally capitated arrangement. But we're not measuring. We have not had any instrumentation to observe this massive leap.
Yeah, you nailed it. The measurement industrial complex as it stands is designed to measure these blunt things that are actually measurements of a different type of system architecture. What you're asking to measure almost requires an AI that can sit there and go, okay, this AI knows everything about humans. It can actually measure what matters to a 62-year-old Hispanic woman in outcomes. What matters to that patient and her family? Okay, now, is the system accomplishing that? Well, what chance does a fee-for-service old-school system have to accomplish that? I'll tell you right now, almost zero. What chance does a relationship-based primary care, direct primary care system where healthcare is turned from a transaction with a copay and a commodity into a relationship? And that transformation yields unique outcomes benefits that you have to measure correctly. And when you do, you see, oh, there's no other way to do this right now. And I think that's the next sort of iteration of this. And the nice thing about, like what people like Hint are doing is they are keeping this sort of database and they're bringing in people from an ecosystem. So there may be a tech company that helps you manage diabetics better. There may be a communications platform that helps you do HIPAA compliant telemedicine better, all these things that power the direct primary care ecosystem. When it comes together, what emerges is something vastly bigger than these little parts because it's driven by a human relationship ultimately, which right now it's not. Right now it's driven by money, really, if we're being honest. And so that I think is a good way to kind of bring this all home. Is that's what these guys are doing, and any chance that we can be to because you and I, like you said, we're lucky enough to get to talk to all these people and also have platforms of our own where we can be like, hey world, look, this is what we think is working. You use books and you use going on the news and talking about it. I use sitting in my basement screaming at YouTube. It's the same. Ultimately, I consider the outcomes to be equivalent, even though your outcomes are much better than mine. But we have to keep yelling about this stuff, man, which is why it's fun to be here.
$16.4 billion spent on measuring quality in U.S. healthcare. That's the equivalent of every U.S. physician having 0.4 of an FTE. And my guess is if you asked every U.S. physician, what would you rather have? They'd rather have a helping hand, don't you think?
They don't want the money. They want somebody who it's just nuts. Is that a real statistic?
Yeah, it's from Health Affairs, a paper that came out 2 years ago on these money that we spend on measuring quality and reporting it. Not even developing measures, just reporting the measures. Those committees where it's like, what are our quality metrics for the month? Well, we got to report it up to our middle manager, who reports it up to the senior manager, who reports it up to somebody. It's like, what are we doing? I mean,
it's just, and then you're just.
You and I, in talking and meeting, doctors, I think we've come to this conclusion together, and that is, doctors are not lazy people. We just don't want to spend our time on things that don't matter. And so much of what we do, ultimately, it's a game of coding, of throughput. It's not about the patient care. And that's why DPC is going to win.
Man, I'm having my fourth middle-age crisis. I have one like Q every 6 months. And what I realized is what you said applies. It applies to everyone, but doctors in particular, because they've sacrificed so much to get where they are, and they've spent so much of their youth like doing this stuff, and then they arrive and they're like, wait, so all this training, all this sacrifice was so that I can click boxes in a machine designed by the measurement industrial complex to basically control the spend of something that isn't my money that I'm never going to see, and I don't get to actually interact with patients because I'm staring at the screen. All right, immediately, all the joy is sucked out of it. You put up an emotional wall. We call it burnout. I consider it chronic moral injury with an end-stage dialysis of burnout, right? And it's meaningless. And I, by analogy, like for me, it got to the point where I am never going to do things that I think are spinning wheels for the sake of spinning wheels ever again. But it took how many decades to get to that point? Most doctors don't have that luxury until they take that little matrix thing that's plugging them into the old system and they go and rip it out, and they see the world for what it is, which is relationships, nothing but interactions and relationships. And they're enabled to do it. They start a practice like that. They collaborate with other doctors and specialists that are doing the right thing. And suddenly the connection, the purpose, the joy is brought back. And then there's not a wasted action. Everything you do has purpose at that point. And that's where we need to be, man. I think that's what this conference is about. That's what the show is trying to get out to the world after it's released to the rest of the world. It's like, this can happen. And it is happening.
It is happening. And it's exciting, right? Because these guys are, there's a reason why Hint Health is growing like wildfire across the country, right? There's a reason why a doctor who's fed up with the fee-for-service billing throughput, hamster wheel is saying, hey, I'm going to just do it. I'm just going to do my direct primary care. And they're growing. And they've got young partners who say, hey, I want to be a part of this, not that, right? And they're adding second sites and they're adding more clinics. And these direct primary care clinics, they've basically figured out the model. The question is, can they preserve that great patient-centered culture? And the ones I've met, the answer is yes, they have been able to do that, right? And so I think that's why they're going to do well, and that's why they are doing well. I mean, it's sort of an after-the-fact observation. They're growing like crazy because of that. And I'm sure there's somebody out there who's, trying to expand the number of clinics that they have in direct primary care just so they can sell it to Optum, which, as you know, is owned by, United. I think. Is that right? But you don't see that in the people that you meet leading, founding, running a lot of the DPCs that I've seen out there, right? I don't get the impression they're so vested, they're so into, they believe in it, right? It's a religion, right? They believe in what they do, and so I don't see them putting down the gavel on the floor of the NASDAQ and then jumping off the company the next day. They're just that's not how they're wired.
It really isn't, and the vast majority of them are individual practices that form alliances and networks virtually. That's the beauty, so that you can have the advantage of a large organization, and that can be facilitated by companies that help enable that, but then individual autonomy. Because that's the other thing with like moral injury burnout is tools, resources, autonomy. If you have those things, you're in pretty good shape. If you're missing any of those, it becomes a struggle. And autonomy is a big one. And these guys, you'll see, you said it was a religion. It is. I have been on the wrong side of that religion at times where I've said things like, I think we can work with big insurance companies in a direct primary care model and they can fund this and that. And oh man, I get messages. People are like, shut your mouth hole. And I love it. It means people are passionate about that model. I mean, we can disagree back and forth, but I think, man, it's the future of medicine is clinician led. It needs to be.
Well, you know what a dirty little secret is in the insurance industry, Zubin, is that they would agree with us. They see the writing on the wall. And why do you think Humana was one of the lead companies to globally capitate Iora and give them a giant head start? Why do you think that some of these other insurance companies now are starting to adapt their Medicare Advantage plans to just do a partnership with some of these? Now that's in a select population, right? They're sicker and older, but I would, without naming anyone individually, I can tell you that people in the insurance industry, they're no dummies and they see the writing on the wall and they're realizing, hey, rather than compete, let's join, let's throw our cards in the fold here.
Nailed it. They see it coming, which means that, and this is where I'm going to address people who are at this conference right now. You guys are the frontline vanguard of this movement to transform medicine to Health 3.0. You're going to do it. Nobody else is doing it, and you're going to sweep specialty care with the momentum into this as well, because that's the next phase of the rollout of this revolution. And I think that the insurance companies, the government, everybody, all the stakeholders, I think the biggest stakeholders right now that I think are vulnerable to this, vulnerable meaning we can, if there's a lever, are the self-funded employers. Like, look, this is perfect for them. Carve out primary care, watch what happens, make it direct primary care. So this movement is going to happen. It's unstoppable at this point. We need to support it any way we can and keep iterating, keep growing it. And I'm glad we got a chance to do it today on the show, Marty Makary.
By the way, if they're going to carve out primary care, I'll just say don't stop there. Carve out everything. I mean, just
right. Just carve it all out.
Every single benefit.
Carve it all out.
Carve out your PBM. Carve out your stop loss coverage. Carve out every single aspect of the so-called healthcare benefits for employees.
Wait, so you don't want Optum? You don't want Optum to own all of it? You don't want one company to do every single thing?
Let's just say that if I were 15 pounds overweight, which I'm not, okay? I'm 11 pounds overweight. But I would not rely on the Optum wellness program to get me down, okay? I'd have no confidence whatsoever.
Yeah.
But after we tackle the medical industrial complex and we're successful, I think it's time to then move on to a smaller but faster growing scam, and that is the Krebs cycle industrial complex.
Dude, I'm with you, bro. The pyruvate industrial complex, it's the worst. Teaching students about the Krebs cycle has so many clinical payoffs. Every 6 months, the clinical dividends just pay themselves, don't they? I mean, last time you were operating on doing a Whipple, I'm sure you were thinking, okay, let's see. So how many ATP was thrown off by step 5 of the Krebs cycle?
Yeah, what's the ROI there? I can't even get like a suture removal kit in the clinic sometimes. And what's the ROI of forcing bright, young, talented people to memorize every intermediary of the urea cycle, every 6 months for 10 years and regurgitate it on an exam?
I'm going to be honest with you. As a rapper, I've always wanted to have an electron transport chain, like just bam, just full of electrons, just throwing off ATP. I think we've done a thing here, Marty Makary. We've trashed the Krebs cycle. We've trashed the medical industrial complex. We've elevated direct primary care. We're two, mildly off-white doctors who just care too much about about bringing back relationship-based medicine and having a good time. And I got to thank you for being a part of this, man, and thank Hint Health for putting this all up.
Well, you've actually been in this in this actual trench of being on the front lines of patient care in primary care. I haven't, so I just love the story of what you've done. But hearing about what people are doing in direct primary care is honestly the most inspiring thing going on in healthcare right now. It is where things are moving fast, and it's not even on the radar of people in health policy. They don't even understand it. But the results are convincing people on a local level to say, hey, why are we on the broken treadmill when we should be in a relationship with a local physician through direct primary care? So it's working. And so for you and everybody in the primary care world, thank you for what you're doing. Thank you for all of this intense work that sometimes is a byproduct not of a system we designed, but a system we inherited. And so I'm deeply appreciative of all the people out there doing primary care. So fun to do this.
Heck yeah. Marty Makary, thanks again. Hopkins superstar, surgeon, blah, 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 author of The Price We Pay, author of blah, 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 blah. He's just a hero and a personal hero and friend of mine. Guys, everybody, I love you. Keep doing what you do, and we are out. Peace.
Love you guys.